I'm Dr. David Hill, and today we're going to be talking about acid reflux disease in infants. Now, all infants spit up at least almost all of them do. That's a normal process. In fact, we now think we know why it's so common. We think that in breastfed infants, the spitting up helps take some of those helpful probiotic bacteria that are present from the mother's milk and distribute them throughout the airway. So if you've got a spitty baby, you can feel a little bit better about it, at least if he or she is nursing. That said, some infants are going to spit up to the point that it's problematic. Gastroesophageal reflux describes spitting. Gastroesophageal reflux disease describes spitting that is problematic. You'll hear that called GERD because nobody really wants to say gastroesophageal reflux disease over and over again. So GERD, or G-E-R-D, is spitting up that causes the baby extreme discomfort, poor feeding, chronic nasal congestion, cough or wheeze, and you don't necessarily have to have a lot of spitting up to have those diseases. I'll have parents who have babies with chronic congestion or wheezing and will suggest that reflux may be the problem. They'll say, but my baby doesn't spit up. They may not actually spit up. It may be that the stuff from the stomach comes up to here, goes into the lungs, and you never really see it. So we always keep that in mind in fussy or chronically congested babies. What are you going to do if your baby does have gastroesophageal reflux disease? Well, one thing is to make the feeds a little smaller and move them closer together, or alternately, if you're formula feeding, to add some rice cereal to the formula at a ratio of 1 teaspoon for every ounce of formula, and then cut the formula volume by about 1 ounce, and hopefully your baby's going to get the same number of calories with smaller feeds. You want to avoid pressure on the abdomen after feeding. You also want to keep the baby in a semi-upright position while he or she digests for 30 minutes or an hour. If these interventions are not working, do talk to your doctor, because there are some medications that we can try that will often be at least somewhat helpful. Talking about gastroesophageal reflux disease, or acid reflux, in infants, I'm Dr. David Hill.